Physical Therapy. We are here to do a discussion on COVID-19 and athletic management. If you were with us a couple of seconds ago, we had a couple of technical delays, so apologies for that, but I think we are up and running now, so hopefully you're seeing this well. So again, my name is Daniel Love. I'm a clinic director with CORT in Corydon, Indiana. I'm going to be joined here in a little bit by Becky Clifton, who is one of our athletic trainers at Floyd Central High School, to answer a couple questions regarding the athletic trainers and return to play for your athletes. But really, we're here to just give you some information on COVID-19 and how we are managing that in athletes, and some recommendations for how you can manage that if you're a parent or a coach or a school administrator, whether you're affiliated with us directly or not. We just want to share some information with you. So obviously, COVID-19 has had a huge impact on our lives over the past year, and continues to have that impact, and continues to be ever-changing right now. And so the information we give you today is going to be the best kind of available information that we have right now, but realize that it's an evolving process. We're learning a whole lot more about this, and in fact, in the last 2 to 3 months, we've learned an extensive amount of how athletes are managing with COVID-19 at this point. Before that, we really didn't have any research. We didn't really have any idea exactly what was going on from the athletic population, but we're starting to get some of that in. We know that that's going to change somewhat, but we've got enough information that we're hoping to share some of that with you today. So as you know, COVID-19 is a highly infectious infection that is spreading to populations, including our high school students and athletes. The good news out of all this is that most adolescents, most high school athletes, most kids are getting mild to no symptoms and are recovering well from this. So easily, when we look at the research, at least 85% of kids who are getting this are either showing no symptoms or recovering without any complications. So the first thing I want to do is put your mind at ease a little bit that, you know, this is not something that we're going to see in every kid that ends up having a positive test. In fact, some of the more recent studies that have come out specifically in college athletes are showing that really complicated cases are down below 5% and sometimes 3%. And so hopefully, if your child or you're an athlete or your students are getting positive tests, the majority of them are going to be what we would consider a standard case, which shows minimal to no symptoms and can return to athletics after their assigned quarantine time in conjunction with medical clearance as well. So for those cases, the recommendations that we have for athletes are pretty simple. And it really comes down to the athlete. You're going to be quarantined for generally a minimum of 10 days. And 10 days is plenty of time to get out of shape if you don't do anything. And so since most of you are going to be asymptomatic, meaning that you're going to be feeling just fine, or you're only going to have symptoms for a day or two on those standard cases, try to stay in shape. Even though you're not at school, keep doing some athletic activities, do some home workouts so that when you come back, you're actually ready to kind of jump right back into practices and sports. And as long as you don't have any complications that arise, then you're going to be able to return pretty much fully functional at that time. The one caveat that I would throw out to that is that sometimes when you do return to activities, you want to be on the lookout for new symptoms, because sometimes you won't have them if you're not very active, but you will have them as you return to activities. But for most of us, what we want to talk about are those complex cases. So I'm going to shift focus a little bit to that right now. So again, percentage-wise, we're looking at more than likely around 3 to 5% of cases, specifically in younger athletes, are going to be what would be considered a complex case. These are going to be athletes or high schoolers that have moderate to severe symptoms. These are cases that may lead to hospitalization, but not necessarily. But these are kids that get a pretty good sickness. Looks like a really bad flu, and it takes them a while to recover. And in these complex cases, what the research has been showing is that the symptoms tend to stay around for longer, and they tend to stay with return to activity or return whenever those students return to activity. And in these cases, it's a little more important to make sure that you're cleared and actually ready to be participating in sport. So a big disclaimer here is that we're physical therapy services. Becky is an athletic trainer. Our job is different from your medical physician. And so Specifically with these complex cases, you always want to get medical clearance to return to sport, and that's going to come from your physician. And so that's one specific thing that you need to keep in mind for this. But we have seen that there are some complications that arise, and again, a small percentage of these cases that we want to address with you today. Probably the most prominent one that you'll read about and hear about, and is also one of the scarier ones, is what's called myocarditis. And especially early on, there was a thought process, and the evidence was suggesting that myocarditis was a pretty common response to COVID, specifically in severe cases. And early studies were showing up to 15% of athletes that had severe cases were showing that. Now, the good news is that the more recent research that has come out is starting to show that number much lower than that. So myocarditis is not as common as what we thought it was. But the way you're going to find this out is, again, communication with your physician. They're going to do some blood tests that are going to show some markers that will show up, but also what's called a cardiac MRI is what will really show that myocarditis. And of course, that would all happen with your physician team who's managing that if you had that. But again, not as common as what we first thought. Another one that you might have heard a fair amount about is what's called multi-system inflammatory syndrome. And this is a response to viruses, not just COVID, but it's a response that we've looked at. And this is usually only seen in the most severe cases at the adolescent level. So you're typically not going to see this if you weren't hospitalized and didn't have a really severe issue with COVID-19. And so, of course, if you're in that category, you're going to be managed by a physician team, and you're going to know that you're in that category without having to watch this video with me. The most common thing that we're seeing that can go somewhat undiagnosed and somewhat hard to manage is what's called post-viral fatigue syndrome. And basically what this is it is extended symptoms past the expected time. And so it might be that you're now 15, 20, 30 days out, and you still get a cough whenever you start to do activity. Or one of the most common ones that we've been seeing in athletics is that you get some tightness in your chest, even though you're a month out from having a positive test, and even though at rest you might be completely fine, but then with activity you're starting to notice these symptoms come. And we're kind of lumping all of that together as a medical community with post-viral fatigue syndrome. And so we're going to talk a little bit here in a moment about some return to play aspects of that can help manage that if you're in that complex case, or if you have that post-viral fatigue syndrome. So return to play is really important. We know that all of our athletes want to be playing. We've had to miss practices, miss games, and if you have to miss because of a quarantine or a positive test, you want to get back as soon as possible. So a couple things that we want to give you for advice. The first is be patient. If you're an athlete, be patient. If you're a coach, a parent, an administrator, be patient with these kids, especially the ones who have had some difficulty recovering from COVID. The fact of the matter is we don't have a great understanding of those extended symptoms. We don't have a great understanding of the post-viral fatigue syndrome. And so as medical providers, we can't even tell you how long it's going to last. We can't guarantee that we can get someone back at a certain point. So we are all asking you to be patient with those kids and be patient with us as medical providers. We do know that it's going to take a gradual return to play. Becky's going to talk in a minute, answer a question that came in about return to play, but generally speaking, in complex cases, it's going to be at least 17 days out from the start of symptoms that an athlete can return to full participation in sport, which sounds like a long time, and it is, but that's because we need to gradually integrate you back into sport. So when you go back, if say you're only quarantined for maybe 13, 14 days, depending on where you're at, and you go back on day 15, you can't go straight back into 100% activity. One, you've been sick for a while and out for a while, but two, we've got to manage you back at a progressive and gradual level. Another factor to keep in mind is you've got to be communicating with your athletic trainers if you have them at your school, and you've got to be communicating with your physician team. Now, some of you might have so much difficulty that you might end up in our clinic, in a PT clinic to help. We have a program called R2 that is a program that we can help you return to sport if you're having difficulty in your schools as well, or if you don't have that athletic trainer as part of your school to help guide you back. So I'm going to pause for a minute. We did have a question come in prior to this that we're going to ask, and then I'm going to invite Becky Clifton in. Again, she's an athletic trainer that works with us, and she's going to help answer this question.
Do your athletic trainers have a return to play program that you use? In the state of Kentucky, the KHSAA has a structured return to play program that they follow. So the athletic trainers in Kentucky follow that program, and I'm not well versed on it because I'm not in Kentucky. In Indiana, the IHSAA suggests that we use the British Journal of Sports Medicine graduated return to play. So that's what we're following over here. So it is a 7-day process for an athlete to return to play. They have to successfully complete each level of that return to play to move on to the next level of the graduated return to play. So it may take longer than 7 days for them to return or complete that graduated return to play. So people have to be patient with this. It's a little hard for coaches and athletes and parents sometimes to understand that it's not necessarily going to take 7 days. It may take longer.
Okay. I think we had another question come in regarding one of the programs we offer.
Yes. I've seen something about your COVID recovery program. Can you explain that to me?
So the COVID recovery program we have within CORT, this is what we're calling the Recovery and Reconditioning Program, or R2 program. And this is something that we started pretty early on in the pandemic. We identified that a lot of individuals after COVID were having difficulty recovering, not just athletes, but we're talking general population. A lot of people were having difficulty getting back to work, getting back to doing home activities, things like that. And this program was developed, and we have rolled that out for several months now and seen a lot of success with it. And so the nuts and bolts of the program are, if you have had COVID, if you feel like you haven't been able to get back to your typical level of function, or you're having difficulty with that transition, contact our offices. We have a program that is developed. It's a strong program that we've seen a lot of success in, where we can help you hopefully get back to your normal typical activities, whether that's work or at home, or in the case that we're talking about today, athletics. And so that's something to really keep in mind. Do we have any other questions that have come through? Okay. So I'm going to wrap this up by just a couple reminders. The first thing is COVID is constantly changing, so information is going to change. So we encourage you to continually seek out more information on those developments. We really want to stress communication. I'm sure Becky would agree with this, but as an athletic trainer, as a PT, a medical provider, you have to communicate. If you're at the schools, communicate with your athletic trainers. Parents ask questions, students ask questions, coaches ask questions, and let's work together to get our athletes back to training. And remember to be patient with yourselves, be patient with us as medical providers, be patient with your athletes as well. If you need to reach us at CORT, we are more than happy to serve you for COVID or any other injuries or rehab needs that you might have. Visit us at www.cort.com. You can also contact us via our 800 number at 800-645-KORT. And we want to remind you that we have 3 ways to serve you right now. Of course, you can come to our clinics in person, see us individually for therapy. We also offer tele-rehab appointments, and we also have rehab at home. And we would encourage you to seek out those options as needed. Thank you for your time.